Ms. Marge, I want to highlight really the testimony maybe between you and Mr. Eaton. You indicated that on numerous occasions the care that your husband needed was denied by the VA, and the suggestion was that you seek care through TRICARE or through a private organization.
That's correct.
Not-for-profit.
That's correct.
Is that, and that's despite the fact that Charlie had a 70% service-connected disability from the VA.
Correct. And he, his rating has actually increased, so he's 70%, but he is rated as IU for individual unemployability, so he is actually at 100% right now.
And what was the reason that the VA made that recommendation that you seek care elsewhere? How did they explain that?
At his follow-up visit after the second suicide attempt, the nurse practitioner told us that the VA did not do long-term mental health well. And she turned around her computer screen and pulled up psychologytoday.com and told us to search and filter for which providers take TRICARE and to connect to a provider like that. The only explanation was they just don't do long-term mental health well.
Is it true, Mr. Eaton, that the VA could refer Charlie to the same place that TRICARE would be paying for?
Yes, sir.
Under community care, under the Mission Act?
Yes, sir. The location that Ms. Marge highlighted is a member of the community care network and would be eligible for referral.
And that caught my attention that where you have helped find a place for Ms. Marge's husband, Charlie, is also would be eligible for the VA to refer to in community care.
Yes, sir.
How do you explain that?
Well, I think without clear defined access standards, the VA is left to other alternatives to find that level of care. It goes back to education, but also really clear. Whenever a veteran is met with ambiguity in this critical time, you can imagine the different barriers they have to face in accessing care. And so we need clear standards that are dispersed across the entire VA that outline what veterans' options are and what their rights are in this case.
Can I add something to his statement?
Please.
So when my husband went to CR Tucson, they actually have a program just for veterans. It's a red, white, and blue program. My husband was there with other veterans and was housed with veterans. Other veterans there had the VA paid for their care there. And so it really seems very hit or miss as to what the provider understands and knows what the process is as to what kind of care they actually get connected with.
That is really a partial answer to my follow-up question with you again, is you know of other veteran families that have experienced similar circumstances, or are you just a one-case circumstance?
No, sir. There's other veteran families.
Mr. Goldnick, you were nodding your head.
Yes, Senator. We saw this a lot in Forge, where, what's the old saying, you've seen one VA, you've seen one VA. Unfortunately, like I had mentioned in my testimony, some VISNs and VAMCs had a great education on community care, others didn't. And when that ambiguity came in with others, that's where people started, unfortunately, what happened with your husband, you're getting into those things, and it's not necessarily something that is standardized across the system. So that really is the bigger issue.
My impression, and you can correct me if I'm wrong, that often the treatment at the VA, if you remain there for the kind of treatment you need for the circumstances that Charlie and Mr. Goldnick both needed, is often opioid prescription. Is that true?
Senator, it's in some cases, right? In some cases it is. A lot of it can be severely and persistent mental illness that the VA works a lot, SPMI. But yes, that is a lot of the times the case.
I don't know whether I made my question clear, at least for the point I wanted to make is there are programs that don't involve opioid treatment, but the VA's tendency is to utilize opioids as a treatment. Is that true?
In a lot of cases, sir, yes, they're looking for a.
Maybe you already answered my question,
Yep,
but I
yes,
wasn't
sir.
sure. Okay.
Yes, Senator.
Anybody want to add anything to what I asked? And if not, we'll go on to to the ranking member. Mr.
Sir,
Lorraine?
thank you, sir. I think the other point that's being missed is that the ability to do case coordination at a national level to understand where the resources are. WWP has figured it out, and they've got a great group of people that do complex case coordination. We work closely with them, but I think that's the absence. There is care out there. It's just a matter of if you know about it, you know about it, but you have to know somebody to know about it. And you need somebody who can navigate the system that way.
Thank you.
And sometimes it's outside.
Senator Blumenthal?